The areas I will highlight on are basically the Qatar Vision 2030. This is a very important piece of work that was done and has recently been approved by the government. It talks about the different pillars which the state of Qatar is working on now, and of course health is part of it. The Qatar Health Wellness Model of 2010 is what my organization has been working on. I'll give you a very brief look at today's healthcare, and I'll give you some of the results of an important survey that we've conducted with the World Health Organization. Talk to you a little bit about what we're doing with health promotion, and this morning we heard from Dr. Zarhouni the importance of this issue. I'll tell you about our health strategies, our primary care reform, something we're putting a lot of time and effort into, and I think it's important to tell you about. And at the end, I'll give you a brief vision or a brief view of our strategy in biomedical research, or our role. The Qatar National Vision of 2030 defines the broad future trends, reflecting objectives and aspirations of the state of Qatar. It highlights fundamental choices that are available to the society. It defines the long-term outcomes for a country as a whole, providing a framework for the development of strategies, national strategies and plans. And basically, it really aims at reforming Qatar into a country, an advanced country by 2030, with a self-sustaining development and a high standard of living for all of its people. It has 4 pillars: human, social, economic, and environmental development. And health, of course, falls under the human development pillar, and with a desired outcome of a healthy population, both physically and mentally. And to achieve this outcome, of course, you all know, we need a comprehensive world-class health system whose services are universally accessible to all. The system has to be effective and affordable. It has to embrace the principle of partnership for cost-bearing. There should be coverage of preventive and curative healthcare, both physical and mental, taking into account the needs of all the society. High-quality research directed at improving the effectiveness and quality of healthcare. Of course, this system has to be integrated, and the direction of the policy which sets and monitors standards. There should be a skilled national workforce, and I think this is one of the areas where there's a lot of focus on today, because we need to build our national capacity where the workforce is concerned, not only where scientists and researchers are concerned, but also in all of the healthcare sector. And of course, we need a continued commitment from the state to continue to provide necessary funds, including, of course, the partnership for cost-bearing. Now, the health vision that we worked on in my organization, which is the Qatar Health and Wellness 2010, really looks at building a healthy place to live and work. First of all, by working on programs in public, environmental, and occupational health. It works on emergency preparedness and ensuring a robust professional licensing and regulation of drugs and treatment. Ensuring a healthy population, focusing on the wellness model. Again, we heard this morning about the importance of preemptive care, and I agree 100%. And this is what we're adopting today, is the wellness model, reaching out into the community and adopting an approach that builds on the well-being of people rather than curative care alone. And of course, implement information links between primary care and the tertiary sector. It also works on establishing a world quality care in hospitals, and of course, you've all heard about the centers of excellence we're working on, and the accreditation that we have achieved. I'll probably highlight some of the areas of centers of excellence, but this is certainly not completely inclusive. There are others, but just as an example, there's going to be women and children's hospitals, and I say hospitals because it's 2 major institutions that are being built at the moment. There will be a heart center for cardiac care, the Al-Amal Center for Cancer Care, Diabetes and Obesity Center, a Neurosciences Center, and a comprehensive mental health program starting in the community and working all the way up into a modern state-of-the-art psychiatric facility. We encourage development with the private sector, and for us the private sector is basically in two parts. There's the pure private sector, And then we have what we call the quasi-private sector, working with some of our more important organizations like Qatar Foundation. We work very closely with them in all their projects. Qatar Foundation, as you know, is a private organization, and they have a lot of interest not only in biomedical research and sciences, but also in providing healthcare and building healthcare centers, and we work very closely with them. We've started to focus today again on, we heard this morning, long-term conditions, neurodegenerative disease. We are starting to age, and the facts are that our median age of survival today is 76 years, which is quite a bit longer than we used to live a few years back, and this means we're starting to see some major issues of aging. That's why we're focusing on neurosciences. And we are building a neurosciences center with a lot of emphasis on research. Our health challenges, mostly in the state of Qatar, probably not unique, but worth highlighting. First of all, it's premature death from injury, like road traffic injury, remains to be a major issue for us. Workplace injuries and accidents. Our infant and early childhood mortality declining steadily. I'm happy to report, and we wish to see them even go further. But at the moment, they are quite good. Early onset of preventable long-term conditions, including genetic factors. I must mention here something that people criticize me for talking about, but we have an issue of consanguineous marriages in Qatar, in our Qatari society specifically. Not among the expatriates, but definitely among the nationals. And this is, of course, linked to some genetic issues, and we are trying to address this from the social aspect and as well as, of course, from the medical aspect. And, of course, lifestyle issues, obesity, smoking, and stress-related mental illness. Today's healthcare services are comprised of public hospital care provided by the Hamad Medical Corporation. These are 5 hospitals which have been JCI accredited. We have 23 primary healthcare centers, which we are reforming today. And we have an expanding private sector, including hospitals like Aspitar, 4 hospitals plus polyclinics and practice, including dental. And of course, you all know about the Sidra. And this is, of course, a Qatar Foundation project. And of course, we have the Medical Commission today screens all expatriates coming to live in or work in the state of Qatar. The other piece of information I'd like to give you, or few pieces of information I'd like to give you on our status is a result of the Qatar World Health Survey. This is a survey, I don't know if you know much about it, but it's a socio-demographic survey. It looks at risk factors, morbidity, it evaluates the healthcare provision status and the health system responsiveness. It's a good survey, I think, and it was very important for us to conduct it. It was successfully completed in 2006, and in collaboration with the World Health Organization, the Planning Council, the Qatar Statistical Authority, and others. It's been conducted in 70 countries worldwide, and it provides a baseline on the way health systems are currently functioning, and it looks at the outcomes and plans the investment. It helps the policymaker to plan the investment for the future. I think I want to go straight on to the results. I don't want to bore you with all of this. The survey targeted a population of about 4,800 households, surveying a total of 29,338 people. It includes 600 questions, and of course, as I said, it looks at risk factors, morbidity, prevalence, and health state responsiveness, expenditure, and so on. What did we find? We found that 12% of the adults reported having diabetes, compared to 8% of adults in the 1998 Family Health Survey. And it indicated that 10% of the respondents were classified as pre-diabetic with a raised level of sugar in the blood. We have newly reported cancer cases remained constant between 2002 and 2007. Al-Amal Hospital reported that 20% of cancers receiving treatment in 2007 were breast cancer among women, followed by 12% of colorectal cancer.